Good morning, everybody. We'll go ahead and get started now. This is Erik Daly from Miller Johnson. I am a corporate attorney in the business section at the firm. And welcome. Thank you for joining us for today's Monday, May 10th, Team 19 Miller Johnson Monday Morning Roundup, where we will discuss a few topics relevant to COVID-19. One or two will be Michigan specific, and then some other topics maybe relevant for folks outside of Michigan as well. I think we have a pretty direct program today, so we'll just jump right into it. First, my colleague Adam Walker from our education practice will provide an update on the MDHHS end of school gatherings guidance that was released a little over a week ago. I'll then jump back on to go through the development related to the PPP funding being exhausted, which occurred last week, and then talk about some of the other remaining SBA and PPP type issues. And then Tripp VanderWal from our employee benefits group and Tim Gutwald from our healthcare practice will talk about the COVID-19 coverage assistance fund and kind of give two perspectives, the plan perspective, and then I imagine that'll be kind of Tripp's point of view and then the provider side as well. So with that, I'm going to toss it over to Adam to talk about the year-end MDHHS guidance. Adam?
Thank you, Erik. Thank all of you for being here early on a Monday morning. In full disclosure, I haven't had my coffee yet, so I will be trying to run on pure energy, pure natural energy. Luckily, I won't be talking for too long because the MDHHS end of school year gatherings guidance that came out on the 27th is not that new as far as the things that we need to cover. There's one or two things that came up in it that has created a bit in the way of questions, but we should be able to tackle those pretty quickly. So before I really get into the meat of the guidance, there might be some sense that this is a little too little too late, coming out on April 27th for prom and graduation, and I can certainly appreciate that. I suppose, on the other hand, we've been operating for over a year now, sort of flying by the seat of our pants, not being able to plan as much as we have because things change quickly. And as I mentioned, there's also the fact that a lot of what's in this is what we've been doing anyway. I'll talk about obviously the distancing and the masking, but we already know how to do most of that. So essentially, this section of the presentation and the guidance itself is segmented into opening up with general recommendations, and then it gets a bit more specific. But generally, MDHHS is recommending, suggesting that 25%, a quarter of unvaccinated in-person students are tested. Now that would include athletes. I was reviewing it again this morning, and I could have sworn I saw it explicitly said including athletes, and I didn't see that when I was reviewing it, so I don't know if it was removed or if it was just in a separate piece that I saw. But there's no reason you wouldn't include athletes in that because, of course, athletes are still students. And so in some respect, if you did want to follow MDHHS's suggestion of testing a quarter of unvaccinated students who are appearing in person weekly, certainly you would have some of that burden alleviated just by what has been going on with the testing requirements that are necessary for student athletes. Certainly, MDHHS would like anybody who is attending an end-of-year event, whether it's prom or graduation or some kind of other end-of-year event, to be tested. They are offering kits and trainings and other ways of support to sort of implement those measures. More generally, when we're talking about end-of-year events, the general recommendations from MDHHS are that the events be held outdoors rather than indoors, that there are cohorts or pods, whatever you want to call them, of 6 or fewer, and that those cohorts of pods don't intermingle. Obviously, there's masking except when you're eating or drinking, and obviously there's also distancing. These are not things that are new. They've been beaten into our heads over the course of a year. So those are sort of the general recommendations, and then we can move on to the specific guidance next. Specific guidance is broken up into your prom and your end of year parties, and then it goes to graduation next, and they're sort of in a way I will explain, there are differences. So for your prom or your end of year parties, there's a the MDHHS epidemic order. Capacity limits are in effect. 300 people outdoors, 25 indoors, and that's everybody, right? That's your students, your faculty, and other staff. That's guests, and as the general guidance says, they would like the testing within 24 hours before the event. You've also got cohorts, distancing, density considerations. The density considerations are things like staggering. They recommended shortening the duration of these events to reduce chances of transmission. I frankly, I don't envy high school students having to go to a dance and dancing in pods of 6, socially distanced, but that's sort of the world we live in for the last year now. So it's fairly straightforward with the prom and end of year parties guidance. There is a little bit difference on the next slide with graduation. So, and this one's a bit longer, but you have your capacity limits, which are in effect for everybody. So if you have you have your 50% capacity limit for entertainment and recreational school facilities, and that 50% capacity limit applies to everybody who's in it, right? It applies to your guests and your staff and faculty and students. So in that respect, it's not different from prom and end of year events. The way it is different is you will see it says indoor 300 guests, outdoor 1,000 guests. My understanding is there's been some debate in the legal community over graduation ceremonies and what it means for 300 guests indoors or 1,000 guests outdoors, and whether that means everybody or whether that's just family, friends, whoever gets invited. And my interpretation of it has been that it was very carefully crafted to be different from the prom or end of year event scenario where it's everybody. In that scenario, it's everybody. In this scenario, in graduation ceremonies, 300 guests, 1,000 guests doesn't include your staff, students, faculty, etc. It means guests. Of course, you're still subject to the 50% capacity limit, and that is applicable to everybody. There's also the second point, which is that the capacity limits for stadiums and arenas is different. Of course, it's not in the slide here, but there's a 20% capacity limit there. So there might be some fringe cases where the 20% capacity limit is actually more restrictive than the 50%, even though you have an overall higher number allowed at stadiums and arenas than you do in other facilities. Now, is that really going to affect most schools? Probably not. But it is something worth thinking about, and it's something we're thinking about pretty quickly, especially because at this point, probably everybody knows where they are already planning on having graduation. So that is sort of the long and short of this slide. I think again that the what guest means is the big question that came out of this, and I know there's been some debate over that, but I think it was pretty carefully crafted.
Now, why don't we move ahead to the PPP Funds exhaustion, which caught people a little bit off guard last week. The New York Times, I think, reported first on May 4th that the funds for the general program funds had been exhausted. So they were not guaranteeing or processing any more SBA on the SBA side any more applications for PPP loans. So lenders stopped accepting applications other than, and we'll get to this in a minute, the community financial institution group, which has a set aside of some funds for smaller lending institutions. But just by way of background, Congress had previously extended the PPP application deadline from March 31st to May 31st. But at that time, they did not allocate any new funding to the program. And it was pretty clear around the time of this extension that the funds would probably run out before May 31st based on like the current pace of borrowing and expected demand. So it's really just a matter of trying to figure out exactly when that would happen. And an SBA staffer had previously testified in Congress that they believed it would be sometime in late April, and ended up being a little bit later than that, so early May. But SBA doesn't have the authority on its own to appropriate more funds. It would require a congressional appropriation of additional monies to keep the general PPP fund open for new loans through May 31st, the current scheduled deadline for submitting applications. And there is a 1-month period for SBA and the banks to continue to process pending applications into June, through the end of June. There's also $6 billion that's sort of earmarked right now for those borrowers who got their applications in before SBA stopped accepting them, and potentially for those borrowers who applied earlier but had their loan applications flagged for some kind of error code hold review or some other kind of review. So it's possible that even if a second PPP loan application or first loan application hasn't been funded yet due to a hold code error or some other review issue by SBA, it's possible that once that's resolved, there still is some money that could fund that loan if anybody's in that situation. But besides that, there's really the only remaining funds for the PPP sitting here today are the funds that were set aside from the Economic Aid Act that passed at the end of 2020 and designated for lending by community financial institutions. So CDFIs, CDCs, MDIs, and micro lenders. And the SBA's website for the PPP has a good list of what types of financial institutions or lenders fall into these categories and helps you locate one if you're eligible to borrow. And not all businesses will be eligible potentially to borrow from these types of lenders, but any new PPP applications going forward, unless Congress steps in to appropriate more for the general fund, would be through these lending institutions or from kind of the existing backlog of applications. So that's been more than a year in the making since the PPP launched in early April of 2020. So where does that leave us? Going to the next slide, Jeff, we still have these forgiveness issues up in the air for many of the larger borrowers in particular, which, may have taken a PPP loan out at that original early April 2020 date, used the funds for all the permitted purposes quickly, applied for forgiveness relatively quickly, and then kind of got stuck in this purgatory or this holding pattern of SBA review. And as of April 25th, which is the most recently reported data from the SBA, there were about 183,000 forgiveness applications under review. And those are just from the 2020 lending. So that doesn't even include the latest round of PPP or kind of the second draw loans that started in early 2021. And those 183,000 forgiveness applications represent about $84.3 billion in principal amount. And I think there's still close to $200 billion in loans from last year that haven't even been submitted by the borrowers for forgiveness, which we'll come back to in a minute. So there's still quite a large backlog of SBA loans under review, and I know this has been a big source of frustration for the borrowers who feel like, rightfully, in almost all cases, they submitted their forgiveness application and responded to all the follow-up requests promptly, but then the SBA has been kind of holding on to these loan reviews much longer than the 90-day review period that it set for itself in its own rulemaking last year. And so far, borrowers have been mostly, frustrated, but not proactively pressing SBA on that 90-day review period. In some cases, I think certain borrowers have had to feel like they've had to push back on SBA or kind of raise a flag to get their loan prior. I don't believe that is necessarily moving the needle in a ton of cases to get the loans reviewed faster, but some borrowers do have hard deadlines for finalizing financial statements or completing transactions, and it has become a real issue for a number of borrowers. So there may be special circumstances where it makes sense to try to more proactively reach out. But in the meantime, I think most banks are, kind of optimistic that given the PPP general fund has now been exhausted and SBA resources have gotten some of the other programs up and running, that'll free up some staff time and resources to quicken the pace of the review, in particular of the 2020 backlog of forgiveness applications, which I think are probably, in terms of what's really under review, it's probably, in my mind anyway, the larger loans, of course, those over $2 million that triggered the auto reviews under the SBA rules. And then, maybe smaller loans where it's more of an identity theft or a fraud flag type situation. So although the average, loan size that's under review is $460,000, I don't think that's probably not a great representation of the two bigger categories of loans. I don't think there's a ton of $500,000 loans that are in a long queue of review. I think it's the ones that are flagged on the opposite ends of that range. But we'll see as some of the data get updated and SBA works through the backlog. And then just one note, because I did mention there were, at least from 2020 loans, close to $200 billion in PPP loans where the borrower had not applied for forgiveness yet. It's important to remember that if you're still waiting to apply for forgiveness, and I know that is the case for some borrowers who had more time, wanted to kind of see how things played out, or got, had other things they needed to prioritize in the meantime, just need to remember that if you don't apply for forgiveness within 10 months after the last day of your covered period, so your forgiveness period, then you need to begin making loan payments on your PPP note. So you probably want to get your application in before that deadline for forgiveness, and then you won't have to make the payments until you get a decision one way or another, and hopefully it's all forgiven. So just something to keep in mind. And then just kind of quick hits and some other SBA program news from last week. On May 3rd, so last Monday, which we talked about on last Monday's Roundup, the SBA launched its Restaurant Revitalization Fund program successfully. They got it launched on the first go round, unlike the Shuttered Venue Operator Grant portal, which initially crashed when it was opened and had to be relaunched. So we're about a week into the Restaurant Revitalization Fund grant application period, and during the first 2 days of the first week, there were 186,000 applications just in the first 2 days, and more than half of those were from priority funding groups. So the priority funding groups are majority-owned women businesses, majority-owned veteran businesses, and then socioeconomically disadvantaged groups as well, or any combination of those. individuals if they are the majority owners of an eligible grant recipient. So it was more than half were from those of the applications were from those priority groups. But it's important to remember, anybody can apply during this initial 21-day funding period for the priority group. If you're not in the priority, then you won't get your grant application actually funded until sometime after May 24th. But you can still go ahead and apply if you're any kind of eligible grant recipient. And then just really quickly on the shuttered venue operator grant program, the SBA is still accepting applications for that program. That's for museums, music venues, movie theaters, live performance spaces, things like that. So if you're eligible for that program and you haven't applied yet, you still can. And that program is still in its priority funding period as well, which relates to, in that case, the level of gross receipts and the amount of the decline year over year. So those hardest hit businesses are being prioritized right now in terms of the application and review process. And then finally, before I turn it over to Tripp and Tim, it's just worth a reminder, because we're coming across this and talking with a lot of clients on the PPP side and SBA funding programs. Although it's not an SBA program, it's important to remember to check on whether your business is eligible for the IRS employee retention tax credits. And if you're participating in any of the SBA funding programs, whether it's PPP, the SFOG, or the restaurant fund, if you can do some planning, you can use those retention tax credits kind of in tandem or side by side with those SBA programs and kind of optimize the outcome for your business. But it may require a little planning, just depending on how you've used the funds from those other programs. So basically, you can't kind of double dip between the retention tax credit qualified wages and some of the other program funding. So if you have questions about that, you can reach out to me, and I'll loop in the right folks from our tax group to kind of coordinate that analysis. But it's been an important source of liquidity for some clients, so I just wanted to call it out for those who may not have that top of mind. And with that, I don't have anything else. I'm happy to answer questions at the end when we circle back up to do a little Q&A. But for now, we can advance the slides, and I'll turn it over to Tim and Tripp, kind of bring us home on the COVID-19 Coverage Assistance Fund. Tim and Tripp.
Thanks, Erik. Good morning, everyone. So I'm going to address just briefly, kind of in tandem, this new thing that was released by the government last week called the COVID-19 Coverage Assistance Fund. And really what it is another mechanism for providers to bill for the administration costs of the COVID-19 vaccine. So Tim is going to explain that in a lot more detail than I am, but I'm going to kind of set the table for him to talk about, what are the individuals that a provider would potentially give a vaccine to, for which that provider would be eligible to submit a claim to this COVID-19 Coverage Assistance Fund. So, and that does have some implications on group health plans, particularly the small subset of non-grandfathered group health plans that may still be in existence today. So before doing that, I think it's important to understand how generally the cost of the vaccine is covered. And so the vaccine itself is generally paid for by the federal government. However, the government doesn't necessarily, or at least in all situations, pay for the actual administration or a provider giving you the vaccine. When providers give the vaccine, and again, I don't want to trample on Tim too much on this because he can cover these areas much better than I can. Providers are generally not permitted to bill patients at all. So it wouldn't be, if they weren't uninsured, they couldn't send them the whole bill, or if maybe they were insured but subjected to participant cost sharing, whether that be a deductible co-payment or co-insurance. provider can't send that bill or can't balance bill the patient. So when we're looking at how the administration is paid for, I think you're breaking it down into different categories. And again, I think Tim is going to talk about this as well. There's a fund that the government maintains for which providers can collect payment for uninsured individuals. Of course, Medicare and Medicaid are both going to cover the administration of the vaccines. And then a lot of private insurances are as well. And this is really where I kind of, become, this is a little bit more in my area, is that, grandfathered group health plans under the Affordable Care Act, or non-grandfathered group health plans, under the Affordable Care Act, must cover the vaccinations with no participant cost sharing, because these are at least temporarily going to be considered required preventive services under the Affordable Care Act. And the way it works is once a COVID vaccine gets its authorization from the FDA, it will then likely either in tandem or very quickly afterwards get approved by the ACIP division of the CDC. And once that approval sets in, a group health plan has 15 business days to start covering that vaccination, with no participant cost sharing. So I guess that leaves, with respect to particularly the COVID-19 Coverage Assistance Fund, the question is, well, who is that going to cover? And after analyzing a little bit, I think it's a small subset of people that are covered by non-grandfathered group health plans, because grandfathered group health plans have to provide preventive services. These individual grandmothered health plans still while they are exempt from some Affordable Care Act requirements, still appear to have to cover preventive care services, and all individual health plans have to cover these preventive care services. So that's going to leave the subset of a few people throughout the nation that participate in these not in these grandfathered group health plans. And I'm sorry, that last bullet point should say grandfathered group health plans that exclude vaccinations or impose participant cost sharing. So I'm covered under a grandfathered group health plan. I get the vaccine. My health plan submits, the provider submits to my plan a bill for the administration of the vaccine, and my plan pays that bill net of, for example, my copayment. As Tim will explain, the provider can't turn around and submit that bill for the unpaid copayment to me because that's not permitted. But now under this new COVID-19 Coverage Assistance Fund, the provider will be able to submit that bill for reimbursement to the federal government. And with that, I will kick it over to Tim to kind of talk about this fund in more detail on the provider side.
All right, thanks, Tripp. We can go to the next slide. As I'm kind of using this, Tripp covered this, provider, this assistance fund here. And I'm going to kind of use that as a jumping off point to talk about kind of different coverage issues that providers are experiencing or might experience as they're administering vaccines, and to another extent, other COVID-related treatment, including testing. So just to kind of cover our bases, and providers are quite familiar with this at this point. This is not new, but CMS prohibits charging patients for COVID-19 vaccines. There's no balance billing. You can't require them to pay anything out of pocket. They also prohibit discriminating against patients based on their ability to pay. Again, this is not necessarily a COVID-19 specific thing for most providers, but you can't say, if someone is out of network and comes to your location, or they don't have any insurance at all, you still are required to administer the vaccine. And a couple other specific things. I don't think this is a huge issue, certainly not with my clients. As Erik has discussed within the PPP loan field, there are some bad actors out there though. So CMS has made it clear, you can't charge for an office visit if they're only administering the vaccine. Providers cannot require additional services as a condition for getting the vaccine. So if someone comes in just to get the vaccine, that's all. If they don't need any other treatment, if they're not there for an annual checkup or something like that, then you can't be billing for those additional services or require them to have a checkup along with the vaccine. CMS also, as Tripp as Tripp covered, prohibits charging for anything other than administering the vaccine. Again, the vaccine has been supplied by the government, so providers are prohibited from charging for that. So when providers are administering the vaccine, there are basically 3 different types of vaccine patients that they're going to run into. One is uninsured patients. Again, these are not sort of new phenomena for providers, but there are unique ways to go about handling these situations within the COVID-19 sphere. The second would be, someone insured with no vaccination coverage or only partial coverage. As Tripp pointed out, because of the ACA, this should be pretty rare, but it must be common enough that the government has felt the need to address it with this new program. And so then, of course, the easiest and I believe most common situation is, someone who's insured, whether it be a private payer or Medicaid or Medicare or VA, someone who's insured with full coverage for the administration costs. Again, so CMS has set up programs so providers will be paid regardless of what category a patient falls in. Again, so there's 3 different ways to get paid. Again, the first category that we mentioned on that last slide is uninsured patients. So there's a COVID-19 claims reimbursement to healthcare providers program. The name is actually significantly longer than that for some reason, but that's all I'm going to put on this slide here. But that program actually covers much more than this new program that we're talking about today. It covers testing, medical care, and vaccine administration. I'll just really kind of focus on that vaccine administration and testing. That's more the context we're discussing today. I'm sure providers are pretty familiar with this fund. Again, there's $5.6 billion have been paid to date, and this program was created as part of there's different money attributed or put into this fund under the CARES Act, under a whole bunch of different bills that have been passed, COVID-related bills that have been passed by Congress over the last year plus. Again, as usual, as we've seen with these new COVID-related programs like the Provider Relief Fund, there's going to be an attestation. If you're going to participate in this program, the government is going to make you attest that certain things are true. So, for example, in this context, again, we're dealing with uninsured patients. You're going to have to attest that the patient has no other coverage. And that means, you're going to have to ask some pertinent questions, determine, what possible coverage might be out there. Assuming that you've concluded that there is no coverage, then you're going to be able to go to this portal here. There's a link down there on that last bullet point. The reimbursement is generally at Medicare rates. The government just increased the rates for vaccination and other COVID-related treatment on March of this year. Again, there are no interim bills or corrected claims accepted. So make sure if you're using this that you get your bills and your claims correct the first time around. It's pretty common for providers that, sending corrected claims for more complicated services. And since this program does include medical care and things beyond vaccine administration, it's important for providers to make sure that they get this right. For a vaccine administration, it's not a complicated billing procedure, so it should be pretty easy to get those claims right. Again, you'll just go to that link there on the portal and submit your claims there, and the government has been paying those claims so far. Again, so now we're moving on to the second group, sort of the inspiration for you getting to see my lovely face and Tripp's lovely face here this morning is the insured, but there's no coverage or only partial coverage. Again, so that's this new coverage, COVID-19 Coverage Assistant Fund, CAF, another fun acronym for those of us who work in the healthcare field. This is the new program, different from the uninsured fund in that it's only for vaccinations. This is funded through the Provider Relief Fund that we're all pretty familiar with at this point. Just while I'm discussing the Provider Relief Fund, just very briefly, for the healthcare providers who are on the call this morning, I wanted to point out that the June 30th is the deadline for using your Provider Relief Fund. So if you received one of those 3 different phases of distribution. Currently, the deadline is June 30th to use up all of those funds. So that's something to keep an eye on as we get closer to that date. There has been some requests made to HHS to extend that date, but so far there has been no extension. Just wanted to make sure everyone was aware of that. Getting back to the Coverage Assistance Fund, again, that's funded through the Provider Relief Fund, also reimbursed at Medicare rates, which were recently increased. Again, similar to the uninsured program, you're going to have to attest a claim was submitted to the patient's insurer, must attest that there's no other third-party payer that will reimburse the cost. And then you can, log on to this portal, register for the portal, and submit those claims through that. One issue that'll be kind of interesting that there's some ambiguity here is that this program allows, so you can backdate this back to February 20th of 2020. Again, there weren't vaccines at that time, but you'll have 365 days to submit these claims. I guess, there shouldn't be any issue given when the vaccines came out that you should be able to get your claims in within that time. But just something to keep in mind, if you have a whole lot of vaccinations that you've done where there's some copay that you have failed to collect, make sure that you jump on that within a year. Again, for those, the last category of people are individuals who are insured and fully covered. And, that's pretty simple. You're just going to go ahead and bill them as usual, and you'll get paid from their provider. And again, providers aren't supposed to discriminate based on in-network, out-of-network, so there shouldn't be any issues there. I did want to jump on the Michigan vaccination update. Last Monday, we went over the Michigan Vac to Normal plan. So I wanted to do two things. One, provide an update on, as of 3 p.m. on Friday, Michigan reported 51.5% of eligible Michiganders had been vaccinated. That was, just an increase of a little under 200,000 people over the previous week. So, at that rate, it's going to take us a little while to get all the way through those stages. On a slightly better front, though, the Department of Health and Human Services kind of late on Friday, after we sort of had our vaccine update sent out to everybody, said the actual number of covered Michiganders is 54%. So that was an increase of about 230,000 people. Officials started factoring in people who had been vaccinated out of state. Again, I'm sure a lot of our listeners are familiar with the idea like snowbirds or other people realizing that they're just working from home, might have been living out of state for a little while over the past year and may have gotten vaccinated in another state. So those people are now counted in that number. There are also federal prisons or other federal programs. Those numbers have been taken into account as well. And that jumped us up to Michigan up to 54% of vaccinated eligible people have been vaccinated. So 2 weeks after Michigan hits 55%, the work from home order will be rescinded. So hopefully we'll get to that 55% at some point in this week, maybe in the middle of the week. If not, hopefully at least no later than the end of the week. And that means, come the end of the month here, that work from home order should be rescinded and everybody can go back to work who, even if they're not essential, or even if they determine that they can't perform, or that they can perform it from work otherwise, or from home otherwise, my goodness. So that's kind of a bit of a quick update that I wanted to give everybody on that Back to Normal, because that was kind of a big jump and came out after we sent out our update on Friday. So thanks.
Yeah, thank you very much, Tripp and Tim. That is a very helpful update all around, and especially as people are planning on returning to the office and kind of end of month activities, Memorial Day, kind of in that time frame. It'll be interesting to see exactly when that all aligns, so that people are headed back into the office in bigger numbers. So we'll obviously continue to track that and do programming to continue to support clients as they prepare for more employees coming back, if that's the case for their business. With that, we appreciate everybody joining us here on May 10th for our Monday morning COVID Roundup webinar. We hope everybody has a great day. Hope the mothers out there had a happy Mother's Day, and be well and stay in touch. See you soon. Thank you.
Thanks, everyone.